Um, yeah, so let's see. I have a private practice. It's kind of psychotherapy oriented, and one of the main forms of therapy that I use is IFS. I'm not sure if you guys have heard much about IFS. It's kind of a type of therapy that's talked about a little bit more. It's often used in like psychedelic assisted psychotherapy. It's not one that, it's not oftentimes considered like one of the main like evidence-based psychotherapies, but it's one that's being used a lot more commonly for very hard to treat clients and people that have very difficult or extreme pathological behavior. And I think it has a lot of applications for how we think about and treat addiction. So I kind of wanted to just present, a little bit about what I know about IFS and a little bit about how you might sort of apply that framework in working with people with addiction. So I'm just going to give a little overview about IFS, just to kind of a few slides on just like the basics of it. And I want to actually try a little experiment where we're actually kind of see what, how that applies to your own systems. And then I'll talk a little bit about how this applies to addiction. But IFS was developed in the 1980s by this guy named Dick Schwartz, and he was a family therapist who was working with people with pretty severe eating disorders, severe self-injurious behavior. And what he found is that a lot of the standard therapeutic techniques really just had trouble getting any traction on managing these clients' behavior. That, in the room, in the therapy, the client would be kind of on board with the plan, but at home, the behaviors just continued to run amok. And it was very confusing for him, very confusing for the client. And no matter what he tried, nothing really worked. So we started to just get a little bit more curious about what was going on for the client. And what emerged is they would often talk about different parts of themselves, like a binging part, a purging part, a shaming part, a sad part. And these parts would kind of take over at different times. And these often weren't the parts that were present in the therapy room itself. And what he did is he started to apply the family therapy techniques to these different parts. So he started to think of a person as sort of like a family, like a parent who's trying to manage all these kids that are sort of running amok. And he found that if you use the family therapy tools in applying to these parts that exist within each individual, it was actually very powerful and really helpful for these sort of self-sabotaging techniques, for self-sabotaging behaviors, or just like clients that really felt like they were at war with themselves. So what exactly is a part? So a part, if you think about yourself, oftentimes we think of ourselves as a single personality, but what IFS proposes is that we as individuals are actually made up of various different sub-personalities within us, that are kind of coming to the surface or going back down, sort of depending on what's happening in our lives. Like, for example, right now you might kind of have parts that are a little bit more, professionalism type parts, or ones that, see yourselves as, psychiatrists or people that are going to help people, or, those are the parts that might be on the surface, like in clinic today. Um, but maybe when you're at home for Thanksgiving or around your parents, different parts come out, and you'll maybe think now, like, well, why was I acting so weird back then? Well, IFS kind of, that's what IFS is all about, is sort of understanding what these parts are, how they kind of take over, what they do when they take over our presence. And IFS uses the term blending. So we become blended with these different parts of ourselves. And you can't really see the parts when you're blended with the parts. It's kind of like this little figure up here. When you're in it, you can't really see it, but you have to kind of take a step back or go through a process of unblending to be able to really see and understand the part. Parts can be experienced in different ways. This is something that exists within your own psyche. So anything that you can kind of imagine is sort of fair game for how you can experience a part. It can be a physical sensation, an emotion. It can be a image that comes to mind, certain ideas, thought patterns. Really anything can sort of be how you experience a part. The other important concept is that there's no bad parts. All these parts are trying to help you in different ways, but you have to think of them a little bit like little kids. They don't really understand the full perspective. And if you start to get to know them and start to befriend them, you'll start to realize that they have that they've sort of taken on certain behaviors or extreme roles that they've been sort of forced to by having to cope with different trauma in their life. And these roles are, this is why parts, some people have, addictive parts or suicidal parts, parts that can be very objectively dangerous and scary. They'll still take on those behaviors because they're trying to help. An addictive part might just be, their one job is to escape from pain, and it's going to do whatever it needs to do to make that pain go away. The part itself isn't bad, it's just taken on a role that's very extreme and doesn't really see the full picture. So by getting to know the parts, by unblending and getting some perspective, you can actually share information with these parts and let them know what the effects of their actions are, and start to open up, basically have a new person in charge of the part, that people no longer have to be kind of possessed by their parts, that they can actually sort of take a step back and choose whether or not they want to go down the route of what the part thinks is best, or if they want to go in a different direction. And by being able to unblend, that's how IFS kind of gives people that agency. So these are the three main categories that parts can kind of be grouped into. When you see a client in your office, you'll oftentimes you'll first sort of see manager parts on the surface. Like most of the time, I would say the average person is kind of blended with certain manager parts. And these are parts that try and kind of control the situation, control everything in the world, basically. And they're trying to maintain a sense of control so that they don't experience pain. They don't want that pain of not having control or being powerless. So these are the parts that, they'll try and control their own emotions with overthinking and with self-criticism. They'll try and control, the behaviors and expectations of other people by people pleasing or being very subservient. And they'll also try and just control the environment in general by being perfectionistic and, externalizing in different ways. But the main thing about managers is that they're proactive. They're taking on this role to avoid the possibility of pain in the future. If pain comes through, that's when it becomes the domain of the firefighters. Firefighters are another protective element of the system, meaning that both the managers and the firefighters are trying to kind of push down any discomfort or pain, but firefighters are more reactive. So when pain emerges or trauma emerges, they try and put it out as quickly as possible. And they'll do this by, this is very important for understanding the addictive process, because this is often where binge behavior comes from. Substance use, suicidality, disassociation, escapism, these are all kind of the tools of firefighters. The final part is the exiles, and exiles are the parts that you don't really often see on the surface. These are the parts that kind of come out when clients are outside the therapy room, when they're at home, or when they get triggered. That's the idea of getting triggered, is kind of like something has poked an exile, and the exile has come out and sort of taken over the system. And exiles are they're sort of oftentimes sort of younger feeling parts that hold a lot of childhood trauma or pain. And, they're the ones that are sort of scared or very sad or have grief or just a feeling of dependency on other people. But the managers and the firefighters are kind of always trying to push the exiles down as much as possible. But the exiles do spring through at certain times. And these can get pretty intense, especially in people that are really sick or dealing with mental health issues, is that parts really kind of block out the whole system. And as people develop better relationship with their parts, they can kind of get a little smaller and a little bit less extreme in their roles. And it opens up this new space in the middle, which is, you see here, the self. And the self is a really important concept in IFS. And the idea is that, well, when Dick Schwartz was doing his work, he would ask, he would work with clients unblending all the different parts. And when all the parts had unblended, clients would often kind of take on this persona of being very calm, very present in the room. They would be a lot more compassionate, just a lot of really good, positive qualities, and he would ask, well, what's this? Is this what's the part here? And clients would just say, no, this is just the self. This is who I am. This is me. So he called this self energy, and this is something that he believes is, at the core of every human being. And it's sort of, I like to think of it as kind of, it's like the sun. The sun is always shining, but clouds can get very thick, and sometimes if the clouds get too thick, you don't see the sun anymore. But the sun is always there, and as soon as you can kind of get a crack in the clouds, the sun will come through. And that's kind of the metaphor I like to use to describe self energy. And the whole point of IFS is that you really want this self energy does not have blinders on. This one sees the whole perspective. So you really want self energy to be kind of running your life as the main like leader in your life. You don't want the parts trying to manage each other. That's when you kind of get into trouble. Yeah. The other thing I wanted to say is that there's sort of a spiritual element of this too. Like some people will consider this to be like your soul. Um, IFS is sometimes considered like a psycho-spiritual therapy. And I just say that because that, spirituality can be oftentimes a big part of people's healing and addiction, or, this model pairs very well with 12-step because it does sort of incorporate that element of it too. You don't have to kind of take that as part of it, but it is something that they discuss a little bit. All right, so that's the basics of what IFS is. Does anybody have any questions about that? I'm going to kind of shift gears a little bit. Yeah. All right. So I actually wanted to do a little bit of an exercise if you're okay with that. It should just be like 10 minutes or so, just to kind of give you guys a chance to get to know your parts a little bit. I've got a few pieces of paper. But yeah, grab a piece of paper and a pencil. Yeah, so IFS, the concepts are kind of nice, but I think it really gets a lot clearer when you can start to actually work with it within yourself and get to understand your parts a little bit better. So I kind of wanted to give just a sample of that here. I'll kind of walk you through like a little, sort of like a guided meditation. You guys don't need the pencils and a piece of paper right now, but just in a second you will. Yeah, so I just invite you guys to, if you want to try this out, you don't have to, but just kind of bring your attention inward a little bit. Sometimes it's helpful to close your eyes and just, tune in with what's going on the inside. Just kind of feel what the weather is like in there. Notice any energy, feelings, thoughts. Maybe you're thinking about clinic or coffee or whatever it is. Just notice kind of what's swirling around inside. And if you feel like there's any element of that that's kind of calling to you, or you'd like to learn a little bit more about or get curious about, just choose one part of what you're experiencing to focus on. And just gently rest your attention there. Try not to let your attention bounce around too much. And maybe just see if this experience shows up in any way. If this shows up in your body in some way, or if this kind of connects with a larger process of thought or beliefs, or maybe an image might come to mind. Just get kind of curious about it and explore it a little bit. See if there's any associations that you have with it. After you've done that for a few moments, whenever you feel ready, you can try and open your eyes and just maybe jot down a little bit what you experienced. And this can be like a picture or a word or a belief. Yeah, whatever feels right to be able to just put it down on the paper. If more ideas come, feel free to add that into. When you've gotten a few things down, just take a moment to kind of look at what you've written. And while you look at it, try and sense how you feel towards what you've written on the paper, how you feel towards this part that you've been getting to know. Do you like it? Are you frustrated by it? Is it yeah, and then write on a different part of the page just a little bit about what feeling this comes up when you think about this part. What's your feeling towards it? And then maybe also just look at how these two parts interact, how they relate to each other. Is this a common dynamic? Are they friends? Are they enemies? Do they protect one another? And just maybe make a few notes about that. And whenever you feel ready, I want to move on to the next part, which is another invitation to go back in. Um, Maybe close your eyes again. And this time, really actually let yourself relax as much as possible. Sometimes it might help to kind of sit back in your chair, um, maybe take a few big breaths. Maybe see if there's any way you can sort of soften your posture, maybe give a little bit more weight to the chair. And just remind yourself that there's nothing you need to do right now, no place you need to be. It's okay to just give yourself a few minutes here to enjoy the breathing. You might notice that thoughts or feelings might kind of pop in. Maybe they might bother you a little bit, they might be a little unpleasant. And just keep a little attention on your breathing too. And with every in breath, see if you can breathe yourself a little bit bigger, make a little bit more room for these things that are popping in. And with every out breath, maybe see if you can send a little soothing energy to these thoughts that are popping in. Just invite them to relax and sort of take a seat. Maybe see if they can give you a little bit more space too. And you can take a few breaths here, or if it feels better, you can stop focusing on the breath and just kind of let yourself breathe normally and just focus on what it feels like to be you, feels like to be alive. And whenever you feel ready, you can kind of come back and maybe like make a circle on your piece of paper and just write a little bit about what came up for you with that. Noticed any changes? And you can also maybe now look back at the original part that you started with and just see if your feeling towards it has changed at all, if there's a little more capacity or um, curiosity maybe for that original part that you started with. Right. Um, yeah, so that's the exercise. I hope you guys found that kind of interesting. Essentially, what I was doing is sort of walking you through some of the first few parts of what IFS therapy looks like. Um, I don't, it's IFS isn't like a guided meditation, it's kind of more back and forth if you're doing it one to one. But essentially, what we did is we, found a part or what we call a trailhead, maybe just any sort of thing that you're experiencing that you can kind of follow back to get to know a part that might be present. Then we focus on that part. We try and make a contract, work with the part, and hold our attention on it. And then we start to try and understand the part a little bit better, to flesh it out, and really get to know it as a separate thing. It's unblended from us. In the second part, when I asked you about how you feel towards that part, that's a very important step because that's really where you see, do you have a self energy relationship with this part, or is another part, are you blended with another part when you're relating to this original part? If there's any kind of negative feelings towards the original part, that kind of implies that you're still a little bit blended. Like if you're frustrated, like you notice your anxiety, and that's what you wrote about as the first part, and then and you feel frustrated towards your anxiety, that's a sign that there's another part that you're blended with. And that means that you really have to unblend from that part as well before you continue working down this model. In the third part of the exercise, I was just kind of doing a breathing guided relaxation meditation to kind of try and bring in a little bit more self energy. And that works for some people, it doesn't work for others, and that's okay. But ideally, by bringing in a little bit more self energy, it kind of opens up some new capacity to kind of progress in this model and get to know these parts a little bit better. I didn't go all the way down the model, but essentially what you want to do is start to really befriend and open up a form of communication with this part and get to know it, get to know its fears, its history. And, once you get to know a part and it starts to trust you, it'll start to show you the deeper layers of your system. It'll start connecting you with maybe exiled parts of the system. And that's where you can go into the second stage of IFS, which is unburdening these exiles. And that's where you kind of have, corrective experiences with these childlike parts that are holding a lot of trauma. And if you can do that, then, you can actually see pretty powerful changes in people session to session. Yeah, does anyone want to share what this was like for them, or you don't have to as well? That's okay. We'll just move on. The let's see. So yeah, I'm going to talk a little bit about IFS and addiction. We're at 8:50.
Have they still seen papers at the time? So we should write 55.
Okay. Okay.
It's not fair.
Okay. Yeah, so I'll talk a little bit now that you've gotten a flavor for kind of like what IFS involves. I want to talk just about how it applies to working with addiction. So first, there's sort of this traditional idea about you know, how addiction is thought about in therapy, and especially like how it's thought about a lot of times in psychiatry is that, we think about the prefrontal brain and the limbic brain, and we're really trying to booster and support the parts of us that are controlling our behavior and enforcing sobriety, and we're trying to, reduce the power of the parts that are causing impulsive behavior and breaking the sobriety and using substances. And you kind of get this like good bad type dynamic. And I think that's all well and good, and sometimes there's a place for that when it's like, early sobriety or when things are really extreme. Like at the end of the day, you just kind of need uh, to maintain some sobriety. But I think that the IFS kind of points out that there's sort of a bigger thing that we need to be thinking about. It's sort of that traditional model is very just focused on symptom of sobriety. And in an IFS perspective, what's really happening here is it's like the manager parts, the self-critical parts are kind of locking up the firefighter parts, but they're not really healing the exile. They're not really resolving the underlying trauma or changing the fundamental dynamics of the system. And what you'll see if you just do this just by focusing on the symptom of sobriety is that sometimes you get more firefighters that just take the place of the original ones. One goes from using cocaine to smoking cigarettes to overeating to relationships. And they're kind of not that happy the whole time. Maybe they're happier than when they were really in the like deep part of addiction, but there still is problems. And I'd say that even a lot of the people, like maybe half of the people in this clinic are fairly stable in their sobriety, but they're still kind of dealing with a system that has problems with it. And I think for people like that, it's sometimes helpful to think a little bit more about the IFS perspective, which is there's no real good and bad part. It's you have a combination of different parts that are interacting with each other. You have this traumatized part that maybe gets triggered, and then that leads to, the firefighter coming in with the alcohol, and then you have an inner critic that blames the client after the binge, and those two fight, and the whole time, a deeper part is being more and more traumatized and getting more and more depressed, getting more and more shame. Um, yeah, so in this model, there's not really like a good part of the self or a bad part of the self. It's just, you can think of it as just a bunch of kids that are trying to do the best they can. None of them see the full picture. Things are getting worse and worse, but you really, our job is to kind of come in and provide sort of an adult, self-led perspective to the system to help them, unblend so that they don't just kind of habitually kind of react and cycle through this pattern, and it can actually be a little bit more agency and choice in the day to day. IFS kind of proposes a more complicated framework, like the original framework. Probably, guys don't think about it this way, but it's just, the therapist kind of treating the client, and the client has the alcoholism. You can get a little bit more complicated framework where it's, you incorporate a family of origin dynamics, dynamics with outside life. You have your own dynamics, maybe with a larger treatment team. And then IFS kind of proposes this really complicated seeming dynamic where, you and the client are not in a unidirectional relationship. There's a bidirectional relationship. You as a therapist have your own parts that are active in the room with the client. I think this is especially true in people with substance use where, we have these parts that really want to maintain control of the treatment and help them and do a good job as therapists and providers. And those get polarized. They get pulled out of us by the client's, ongoing use. And, that can be kind of a dangerous thing because then that can lead us to colluding with the manager parts of the client that might be shaming them. And we might unintentionally kind of add more shame to their system. Like one example that I like is, if you have a client that comes in and says, hey, I just haven't smoked a cigarette in 30 days. Like, I feel great. Like, and you say like, wow, that's really impressive. You're going to live a lot longer. Like, here's the research to show it. And, you really congratulate them. I think that's sort of an intuitive response for us, but, IFS would say like, there's something missing here. There's the part of them that really enjoys smoking cigarettes. We don't really know anything about that part. It's like, if you're doing family therapy and a mom brings a little kid in and the mom's like, well, he just got an A on a test, and you just spend the whole session congratulating the mom on how good the kid is. It's like, no, you want to make sure you're also bringing the kid in. You're wanting to not alienate the firefighter parts of the client, and make sure that they know that they're welcome. So, if with IFS, you might say, congrats, that seems like you're really happy about this. I'm curious, is there any part of you that feels a little ambivalent about quitting smoking, or any part of you that misses it? And that kind of shows that you're inviting in some of these other parts, and you're not going to demonize the parts that still want to smoke a cigarette that probably still exist in the client. You can also just think about more complicated dynamics with the client and their families, you and the treatment team. Once you start seeing IFS, it kind of opens up a whole new world about how a lot of people are interacting. Treatment teams can get polarized and, they'll get hopeless about a client and then they'll sort of say like, you need to fix them, you need to prescribe medications. And, this kind of gives a little bit more framework to think about all these different dynamics. Um, yeah, this is kind of getting into like how you actually use IFS. There's three different ways which IFS is used. Like the way that I was kind of doing with you guys is Insight IFS, which is sort of the way that the model is meant to be used, where you're actually kind of just facilitating the client working with themselves. You're kind of letting them tap into their own self energy and heal their own parts. Um, that works for some people, but especially people that are deeper into an addictive process or have stronger parts. That sometimes isn't always possible, and sometimes you're working with your own self energy and the client's parts, and that's called direct access, and that's on this side of the spectrum. Um, so when clients are really blended, like you'll often see, maybe they're very externalized or they're very caught up in the feelings that they're having or the parts that are present. You kind of have to use a little bit more direct access or a combination of insight and direct access. Which is why it's so important to kind of keep track of yourself when you're working with people that are, more stuck in this blended state. You just don't want to polarize your parts with their parts. You want to make sure you're still coming in and checking in with yourself and doing your own work on yourself. That's a really big part of what IFS is all about. Yeah, so this is my last slide. This is just like a little summary on some principles to take away from how to use IFS in addiction and why I like to use it. First is that it's non-pathologizing. It kind of proposes addiction as an imbalance model. That the kids are trying to drive a car and you're just trying to get the parent back in the driver's seat. It's not a moral issue. It's not a laziness issue. Um, it's really just that there's an imbalance in the dynamics internally. It proposes the idea that there's no bad parts and that it's even possible to have compassion and gratitude um, for these parts that have probably been demonized throughout the client's entire life. And that by doing that, by having a little bit more positivity towards these demonized parts, you can really learn a lot more about their history, how they came to being, and sometimes it helps you have a lot of compassion for the client as well too. Really understanding why they drink, where that started, what drives them to drink. It really helps kind of open up uh, more like there's a lot less struggle if you're using IFS. Like once you start getting resistance or you feel like you're in a power struggle, that kind of is a sign that your parts are coming in with a lot of agenda. And that's kind of a sign that you need to sort of think about how you're showing up in the room. It's very focused on you as a therapist or you as a provider and kind of keeping track of how you're showing up. We do have these therapist parts that want to be useful, needed, and in control, but that agenda kind of leads the client to polarize against us. It leads them to maybe feel more shame or keep more secrets when they're in the room with us. And, that's something that isn't really helpful. IFS is also trying to treat the system as a whole, not just the symptoms on the surface. It wants to kind of diffuse the polarization, soften up extreme behaviors, and can actually potentially work on the core trauma that drives people to, have all the pain that they have in their life. There's also a way of working with IFS in the external system, how people interact with their families, their partners, how legacy burdens are passed down through generations. And I didn't get into this, but the IFS kind of views addiction as a sort of a shame-based condition. It's shame as a state of being is kind of what's driving a lot of addiction processes. And by taking an approach like IFS that's a lot more depathologizing and friendly and accepting, it kind of helps to undo that shame, which I actually think is like a pretty big danger of our treatment of patients is that we have a lot of possibility of sort of subtly shaming people without really realizing it, even when we're very well intentioned. Yeah, so that's my presentation. Thank you, guys.
Yeah, have you encountered students or clients who are resistant to the concept of having parts because it feels like they're pathologized into a multiple personality and they say, I don't have the idea, this is a bit
Yeah.
much for me.
Yeah, you do hear that a lot. I mean, part of that is a little bit, I mean, you can sort of share the model of IFS, like that there's sort of a spectrum and parts get more and more extreme, and like DID would sort of fall on that spectrum of like the most severe end where there's amnesic events between the parts. That's kind of, but in a way, it's sort of nice to share that information because it also says like, everybody exists on the spectrum. Personality disorders are a little part of the spectrum, normal people are part of the spectrum. It's just all it is just we all have these parts that parts just when you're DID. Everybody's got parts we're born with, and it's just about making it so they don't take on as many extreme roles. So I kind of give a little spiel like that. I also don't try and push the model of parts. Like a lot of times I'll be doing IFS in my mind, but I don't share that. Sometimes I'll say parts and people just won't like that idea. They like to think of themselves as a person, or they like to think of themselves as a single thing. And in my mind, I'm just like, well, okay, I'm just going to be doing direct access, which kind of looks like regular therapy for a while. And usually with time, they'll kind of open up. That just means there's kind of a manager on the surface that's really resistant to a new model or maybe giving up control to your model of therapy. They want to keep their model of therapy. And that's just something you kind of like roll with. And you don't want to have too much agenda about pushing the IFS either. So that's kind of how I see that. That's a good question.
Several applications, they were also saying, well.
All right, thank you.